After promising news from Pfizer and Moderna, states and hospitals are making sure they have a plan ready to determine who gets the vaccine first. Laura Anthony spoke with one San Francisco Bay Area hospital on their strategy once a approved vaccine arrives.
Bay Area hospitals like Walnut Creek's John Muir Medical Center will be ground zero when it comes to receiving the very first COVID vaccines, once the FDA grants emergency use authorization. Dr. Nick Mikas is in charge of vaccine logistics for John Muir.
Those would be ICU nurses and staff caring for COVID patients. Those would be ER staff caring for COVID patients or at risk for exposure to COVID patients as they come in through the emergency room.
After the initial stage, the vaccine distribution inside John Muir would move on to other employees in the hospital and vulnerable patients like those over 65 or with other risk factors. The vaccine distribution plan here at John Muir in many ways mirrors what's expected to happen at the state and local level. The big question, once a vaccine is available to the general public, how many people will feel comfortable getting it? Recent polls suggest that as few as 30% of the public would definitely get it.
If reputable people like Tony Fauci and others who are well credentialed tell me that the research is done and it's safe and we should try it, I will.
Others want more information.
From the doctors, from nurses, people involved in the clinical trials, I'd like to see what information is out there. You know, how is it going to affect me in the long term?
We'll let the trials finish. We'll make sure that there are no increased incidents of adverse events, and then we'll see how it. And we'll have to see how it goes. I certainly plan to get the first dose that's available to me.
Hospitals here and across the country could begin receiving and dispensing the vaccines inside their facilities as soon as next month.
The CDC says it's safe for new mothers to breastfeed even if they have suspected or confirmed cases of COVID-19. In new guidance released this week, the agency says breast milk is not a likely source of coronavirus infection. That's in contrast to what the CDC originally said last summer when it was less sure that it was safe. The new guidance says that breastfeeding women should wear a mask and the baby should be quarantined along with the mother.